Why did Robert Malone speak out against the mRNA technology in vaccines when he would have gained so much more by being silent? Because if you understand what happened historically, and I tell you this is going to become a historical reference point, you would understand why I asked the question. What I've got here is essentially a compilation of all of his conversations. So this was from the Capital Conversations, the science behind the mRNA vaccines. You can see that the first one here was in 2022. It was a roundtable discussion on COVID vaccines. And also in 2023, he had another discussion, and this one here was with the House of Representatives in November 2023. And then he had a further conversation in 2024 around the federal health agencies and the COVID cartel. And so this little excerpt, and it's more of an excerpt rather than an ebook, is available on our Kickstarter site. So we've put it together, just really the questions and answers that he had at the time, and raising some very important questions. So what we're doing is we want you to support our Kickstarter, and therefore the link to this great excerpt is available there. This is what you'll come and see. We are close to our target, and so we only have 4 days to go. So for those who want to support us, please do. And it really is about the book Disease X. Are you prepared? And in truth, what we're targeting here is the fact that we expect that this disease X, which is, in my view, going to be technically COVID, is going to be coming. Our is here. And we're putting together the content so that you understand the science around everything. It will be 16 chapters and just some information for you to be able to put together. So help us to get this into existence. And here will be the free link that you can then get this ebook. So we're encouraging you to go to that link in order to support us. You don't have to purchase or support us financially, but we are encouraging you by making you go there. But let's get back to this question. I'll explain something important about Malone. I was the first person to do a video interview with him all the way back in June of 2021. And it was because at the time I didn't even know about the connection with mRNA. I was talking to him about something else. And this became the centerpiece of our interview. And from there, he's gone on strength to strength. He's interviewed regularly all over the world. I don't want to take credit for that, but well, maybe I should. But the point being is that I got to see him right at the start, and I got to see his pain about what occurred with regards to the technology. You have to understand that at the time, he was a PhD student in the Salk Institute, and he didn't finish his PhD because of all of the issues that were occurring around the time. But let me tell you something. When you think about mRNA, and it is a remarkable technology, I would argue that maybe they picked the wrong disease with COVID-19, but that's a separate discussion. But the point is that he envisioned the idea. Now, there's a very important differentiation between the Nobel Prize that was given to Weizmann and Carrico, because they switched the technology from using uridine to pseudouridine. And that was very important because the problem that they faced early on, even though they thought of the concept, they just could not get the immune system, they couldn't get it past the immune system in a way that it would be effective. And so the transition of using pseudouridine instead of uridine is actually the reason why it was able to be used as a vaccine. And this is why the Nobel Prize was given to Carrico and Weizmann for pseudouridine. not for mRNA. Very important differentiation, because they couldn't give it for mRNA because they didn't envision the concept. I'd liken it to penicillin. Fleming saw the idea when he looked at his agar plate, and he realized that there was a product being produced that could kill bacteria, but he didn't go on to make penicillin. He had to collaborate with somebody else to then bring it into the real world. And when the Nobel Prize is given for that, or was given for that, he was included because it was his vision that allowed it to be created. So similarly, they couldn't give the mRNA technology the Nobel Prize because they would have to include the person who first saw the idea. And this is what he did. He can tell you exactly when he came up with it, what he was doing, how he did the first experiments. And then because he's just a student, the credit doesn't really go to him, especially because he didn't complete the PhD at that time. But the fact that he was able to envision that really caused a problem for people who were supporting the narrative, because it's so difficult. If the guy saw it and if he envisioned it and he says to you, listen, you got to be careful, why in the world would you ignore him? And they only ignored him because what he said was not supportive of what they actually believed. Now, when we look at this excerpt here, and as I said, we largely just took what it was that he said when he did the roundtable discussion. This was in 2022. And you can see here that he went on to explain characteristics, the main points. So this is the summary as to what he said. You can listen to the full interview if you want. But then he did a question and answer session right at the end where specific questions were asked and his specific answers were put in. This is a very, very useful document for you to have. And you know where it's going to be relevant? When you're in that debate and people are saying all kinds of things and you want to say, listen, this is the reality, this is what the guy who put it together says, why would you ignore it? If you accept and acknowledge the benefit of the technology, you have got to listen to the person who envisioned the technology, because their mind clearly is working at a higher level. And when I interviewed him, it was so fascinating to see how he analyzed these situations, how he came up with the ideas. And so I think that without a shadow of a doubt, he should not have been ignored. His concerns should have been addressed. I've explained to people before that the reason why I am cautious with regards to the science around the technology is because I know that it has to evade the immune system inside the cell in order to be effective. What that means is mRNA is normally produced, but it's destroyed very quickly normally inside a cell. It then makes proteins which the cell can use. The problem they had is that they had to get it past the normal immune checks inside the cell. Things like a RIG1, MDA5, which would then bind to any foreign RNA and destroy it, because this is how it prevents a viral infection. Now, they had to therefore evade that immune system in order for it to make the spike protein. So it's great that it can make a protein, but the question that I still have is, if this occurs in an immune cell, for example, a long-lived immune cell that is not destroyed, how does it switch off this mechanism? That's really the question, which I haven't been able to find a good answer for, because I don't think it has been studied adequately. And these are part of the concerns that exist around the technology. And you have to remember, as I said, I had the privilege of speaking with the envision of the technology, so I know how valuable it can be. The question is, when do you utilize it? How do you utilize it? What are the safety concerns? And what can you do to manage longer term risk? I think those questions haven't been fully answered before they try and move on to even self-replicating mRNA, which then produce more mRNAs inside the cells and continue to make protein. So there's still a lot of questions that have to be answered. But I don't think you discard the technology, even though, as I pointed out before, I have a feeling that it was used in the wrong disease. Anybody who has followed my research will know I talk about autoimmunity. The spike protein triggers autoimmune responses. That's well acknowledged. So the question then becomes is if you use it to make spike protein, which then triggers autoimmune responses, it can damage the credibility and the value of the technology, the mRNA. And that's what I think could happen out of this pandemic. Even though it has value, it may be completely destroyed by the time all of the other things that we are concerned about come into being. So this is the reality. But as I said to you before, my whole purpose of this is that I want you to support our Kickstarter. So I want you to read this document and try and see if you can get us over the line. We only have 4 days to go. 45 people have backed us so far, and we're still not at target. And it only goes through if we hit the target. And so we have a little bit more time to get this support. Any kind of support is valuable. We really do appreciate it. And so this is really an encouragement to try and see if you can help to push us over the line. For free, whether or not you support us, you will get access to this valuable document. As I said, it will become a historical reference point because this technology is not going anywhere. It still has things to be ironed out, I agree, but the principles as to how it can be used, certainly in things like cancer, in certain genetic diseases where certain proteins are not being made, it has certain value. But again, it comes back down to how do you mitigate the risks? It's being promoted primarily at the moment as a vaccine, but that doesn't properly elucidate what are the parameters that you need to look at to make sure that it can properly function in that way in the long term. We still have a lot of analysis and research to be done on it. That's my view. But in the interim, listening to what Malone had to say at 3 different capital discussions with question and answers are very, very valuable for you to see. And as I said, final point here, as give you an example here, Dr. Malone discusses ways to trigger an immune response and the theoretical advantages of using messenger RNA. And he highlights the answers there and the risks associated with DNA recombination, which is a form of genotoxicity. So it can cause toxic effects to your genome. This is one of the theories that he's had, which is why there were limitations for many, many years as to how it was used. But the principle being, it could still have value in the long run. But to get it, please go to the Kickstarter page. The link is below. Join us for some of the other projects that we're doing. We're continuing to build out the information, and we're continuing to support you in this journey of how do we get past the pandemic without losing too much from our health. Have a great evening.